Good morning. Welcome and thank you for joining us for week 3 of our Northern Light Health Business to Business Zoom conference. Today's topics are risk mitigation through infection prevention, communication, and de-escalation. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. I'll be your moderator for the next hour. We appreciate you letting us know what topics are top of mind for you. We want to make sure this hour is useful and can help you safely get back to business. Northern Light Health is more than a 10-hospital system. We have over 12,000 employees. Every day we're screening thousands of people, employees, patients, customers, and visitors as they enter one of our 125 locations around Maine. We think about safety every day for the people we support and serve in our administrative and financial offices, retail pharmacies, food services, and walk-in care services, just a few of the many locations providing services beyond the bedside. We are working through many of the same issues you are, and we hope our experiences can help you. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon Northern Light Health's own experience, which may or may not apply in your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. Please use the chat function to ask questions. You can do this anytime a question comes to mind. I'll keep track of them and ask our panelists to answer them. Also, to help us get a little more detail on how we can best support your efforts, we are going to email a 5-question survey following our Zoom conference. I encourage you to take a moment and let us know if this information is helpful and what topics you would be interested in for future sessions. Let's get to it for today. Our panelists are Suzanne Morshead, a nurse who focuses on infection prevention. She's been integral in guiding our understanding of this disease and how to keep people safe. Also joining us today is Suzanne Spruce, Chief Marketing and Communications Officer for Northern Light Health. Suzanne S. has been with Northern Light Health for nearly 20 years and is responsible for brand, strategic communications, public relations, marketing, and web applications. Also on our panel today is Yamaya St. Clair, an Employee Assistance Program Counselor at Northern Light Workforce. She has her master's in mental health counseling from USM and has been supporting employees across the NLH in workplace trainings, leadership coaching, and incident responses. And Dr. Jim Jarvis will join us with an update on testing and the latest CDC guidelines for safely managing during this pandemic. First up is Suzanne Morshead. Suzanne, what are we doing to keep people safe when they come to us for services or to work?
Thank you, Dr. Gilkey. As part of the Northern Light Infection Prevention Control Council, one of the responsibilities that I've been charged with and where I spend most of my time lately is providing technical advice on how the Northern Light Health system can resume services and bring staff safely back into our facilities. The process that Northern Light Health has been navigating for the last few months to find a safe path forward is quite similar to the journey that each of you are now undertaking. Navigating all of the regulations and science while trying to keep track of this changing guidance is challenging. My team of infection preventials from across the service or system have been working through all of this information as well. And what we keep coming back to are a few practices that provide the basic framework to help prevent the spread of COVID-19. These same principles can help keep you, your staff, customers, and ultimately your businesses safe. What it really boils down to are just a few simple items. Most importantly, universal masking. With everybody wearing a mask, even if they are feeling well, the spread of COVID-19 can be slowed or even stopped. The science behind this is getting stronger every day. We're learning that those without symptoms can spread COVID-19 easily. Masking helps keep that virus from traveling from person to person, keeping all of us safe. As you're able to provide masks to customers that may not have them as you enter your buildings, that would be helpful. And I'll talk a little bit more on masks in just a moment. The second basic item is keep everybody 6 feet apart. This is staff as well as customers. I think most businesses do a pretty good job in keeping customers away from staff, but maybe not quite so much in keeping staff separated from each other, and that's just as important. If you can't possibly keep people separated, you might want to think of some other alternatives, such as alternate work schedules, letting some people work from home, or installing barriers such as plexiglass or making cubicle walls higher. In an upcoming talk, there'll be more detailed information on how to socially distance within your own business, along with some very practical tips. You should also screen your staff and customers. Ask questions like, are you feeling well? Have you been around anybody that's sick? This is the time to encourage staff and visitors coming into your business to stay home if they're not feeling well. The CDC has a list of all current symptoms, and Northern Light Health is happy to provide our screening questions to you if you're not quite sure what to ask. In terms of these first 3 practices, there's a question you should ask yourself, and it's a question we use a lot at Northern Light Health as we look critically at our own facilities. And that is, if somebody comes into your business, whether they're staff or a customer, and they end up positive for COVID-19, who's exposed? And what does that exposure potentially mean? In terms of an immediate effect, everybody that was within 6 feet of that person for more than 15 minutes without both people having something covering their mouth and nose are all potentially quarantined for 14 days, keeping them away from your business. And that's a best case scenario. At worst, somebody becomes seriously ill with your business at that center of the transmission. You could be forced to close to clean and then have to endure the negative press that goes along with that. So that's a question you should consider with every practice that you decide to implement or not to use. Now, going back to masks just a little bit more. I know some people think that masking is controversial. It really isn't. There's a lot of science that shows that masks do help slow the spread of this. While the virus may be small, it can't travel on its own. It needs to travel on something. What it does is it hitchhikes on the larger droplets that we expel while coughing, breathing, talking, and those are large enough to get trapped in most of the various face coverings. As long as the face covering covers both the mouth and the nose so that the wearer's breath and the virus within the droplets of their breath, it'll get trapped within that. And it will also help decrease any distance that it may spread, helping to slow it down. So whether the face covering is a medical mask, a scarf, or a bandana, it serves that purpose. There's really only one type I don't recommend, and that's a mask with a vent in the middle. While it allows for easier breathing, it doesn't control the breath of the wearer from escaping. Now, you may not be able to stop a customer from coming in with one, but I certainly wouldn't have your staff wearing those, particularly if they're around anybody for extended periods of time. Another type of personal protective equipment that you may be wondering about are gloves. As I've started to venture out on my own, I noticed that there's a lot of people wearing gloves continuously. This really isn't necessary, and it's probably worse than wearing no gloves at all. Now, gloves are appropriate in some settings, such as food service, but in other settings, unless they're being changed between every single customer, they don't provide any protection at all from spreading the virus from person to person. And sanitizing doesn't help because most gloves can't be sanitized safely. The high alcohol content in most hand sanitizers degrades the integrity of the gloves, causing small holes, which in terms of protection to the wearer is really worse than no gloves at all. Now, speaking of hand sanitizer, in terms of safety, it's equal to soap and water. All you really need to do is just make sure you're cleaning your hands long enough. 20 to 30 seconds of rigorous rubbing and covering all surfaces of the hands for hand sanitizer is just the right amount of time. If you're using soap and water, sing the song Happy Birthday. By the time you're done, your hands will be clean. Now just keep in mind that if your hands are visibly dirty, soap and water is always the best. One of the other hot topics that has cropped up around Northern Light Health System is whether or not our cleaning practices needed to be adapted as we started to resume services and brought more people back into our facilities. It's also a question I get a lot from different businesses that call in asking, are we cleaning everything we should be cleaning, and am I using the right cleaners? The first thing you should consider is locating what all of your high-touch items are. Walk through your businesses critically and look at those places that hands are naturally drawn to. Some are going to be very obvious, like door handles, push plates, but others not so much, such as your time clocks. Most people overlook those. Make a list of these items and note how many different people will be touching the same item. The more people that touch an item, the more frequently it needs to be cleaned. Now, only you can determine the exact frequency, but Northern Light Health does have a checklist that's available to you to help identify what those items are and to also help provide some guidance on the frequency and timing of cleaning. When choosing cleaning products, it is important to make sure that it is effective against the COVID-19 virus. And it really is a fairly simple process. On the label of every cleaner is an EPA registration number. I have a picture of a cleaner that's just one of my own household cleaners. Down at the bottom, there is an EPA registration number. In this case, it's 581321. Just type that number into the link that's provided on this at the bottom of this slide and also in the checklist that I just referenced, and it will tell you if it's effective against coronavirus. It will also let you know how long that product needs to stay wet before wiping off. Sometimes you hear this also referred to as a dwell time. Every product has a unique time. It must stay wet on a surface before wiping it off to be effective in killing a particular virus. You can also find wet time information on the instructions on the label of products. There are a few questions that come up quite frequently. Mostly, it's around items that are transferred between many people. Most relevant to businesses are cash. Is it a risk? Should I accept it? But if I don't accept it, do I potentially lose a sale? Now, cash, while somewhat grimy at times, truly does not pose a significant risk as long as you provide a way for your staff and customers to sanitize their hands after handling. So keep a bottle of hand sanitizer at the register and you will be just fine. The same holds true for paper items. Wash your hands after handling. If your customer needs to use a pen and you can't readily clean it afterwards, let them keep it. And if your logo's on the pen, even better. Finally, look around your industry. See what your peers are doing. Look for those great ideas. The evolution of curbside to allow for social distancing has been a game changer for some businesses. But as you do this, look cautiously. There is a lot of misinformation out there. If somebody is doing something radically different or out of line of what you perceive as common sense, verify with a reliable source to make sure that you truly are using the best practices. Use sources such as the federal CDC or Maine CDC. These are the ones that Northern Light Health rely on daily. If you start to feel overwhelmed with the volume of information out in the public on COVID, remember, taking just a few simple, common sense steps are really what will keep you and your business happy in this uncertain time. Thank you.
Thank you, Suzanne. And now we will hear from Suzanne Spruce. I guess we've learned over the past few months there's no such thing as too much communication. Suzanne?
Thank you, Dr. Gilkey, and hello, everyone. During this coronavirus pandemic, I've thought a lot about what the Spanish flu pandemic must have been like for our grandparents back in 1918. with no instant gratification, social media, 24/7 news, no Google, no Alexa, no Siri's, no real-time access to health experts, no wild conspiracy, and finally, no friends unfriending friends who have differing opinions about what to do in a pandemic. But here in 2020, who do we believe when it seems everyone fancies themselves an expert and everyone has a platform? It's time to be brave. It's time to take charge and clearly articulate our messages and think about how we deliver them before those around us define us. So sharing reliable, trustworthy information is critical, and your staff, your customers, your students, whoever your audience is, will appreciate that and you for doing so. In April, Northern Light Health surveyed Maine consumers across the entire state. 46% of the respondents told us that they had chosen to delay both emergency and wellness care during this pandemic. And as we dug a little deeper into that data, 66% told us that they wouldn't feel safe re-engaging for another 2 months. So that time frame is right now when we're trying to get people to re-engage with us again. And there is a logical link between people who are willing to put off going to their doctor being the same people who might be laggards in feeling it's okay to go out to eat or to go shopping. So what do we do? Sadly, there is no handbook on how to communicate successfully during a pandemic that I can recommend for you. But I do subscribe to a belief that we should never waste a crisis. A crisis provides opportunity to stand up for our beliefs. It defines who we are. And depending on how we handle the events of a crisis, we can emerge stronger. Few of us could have been truly prepared for or even predicted the extreme hardships of COVID-19. This virus is proving just how important it is to have a communication plan that helps keep us true to our values. And this communication plan should be written down. It does not have to be lengthy or detailed, but it will help you set expectations and create the right environment during times of stress when it can be difficult to think clearly. It's a map of activities. It drives to a strategy that defines how you want to be known and how you can best serve and protect your customers. So first, be intentional about telling the public what you need them to know. That could just be that, hey, I'm open, and what you can expect when you're inside my business. If you have a budget, advertise. But that doesn't mean you have to spend a lot of money. You can do a lot for a little. And hearing directly from you will help kill those rumors that are out there, and it will also set expectations about what you expect inside your business. Second, let people know about safety measures. Northern Light Health posted a series of videos telling people about the safety and cleanliness of our facilities on our website, and they're on social media now with introductions from our physicians. And we did that to show our customers that the things we've always done to keep them safe, we're still doing. They might not have noticed it before COVID-19. And so while you don't have to make a video, videos do trend very well on social media, and they do not have to be expensive. If you have a smartphone, a quick homemade video is free. It can be easily accomplished, and it actually can bring you great results. People love homemade videos on the internet. And how creative can you be to catch their attention? Also be empathetic and reassuring. Do you have hand sanitizer for your customers to use? Tell them. Are face coverings required or are they suggested? And how many people can be inside your business at once? Know what to do if you say face coverings are required and someone shows up without one. Others are watching you, and this is not a transaction. It is a relationship with your customers. The world has a love-hate relationship with social media, but it is still effective and affordable. For just a couple of dollars a day, you can get audience targeting and results. Facebook makes it especially easy, and Facebook is effective. So remember that pictures are still worth 1,000 words. Keep your copy short, your posts short, and your pictures light. Be creative so people will want to share or click on your links. Don't get political or preachy. Both are a turnoff, and there's enough of that already out there. Informative and fun. Own the internet. And this is also a good time for goodwill. People are cautious. Many are ready to engage. They want to help businesses and organizations they like. They also want a good experience. And you set the tone. You need to make sure that the people who are working for you are delivering the tone that you expect. Recently, I had a friend tell me about a visit. She went to a store that had a sign on the door that said 15 people inside, you must have on a mask. So she kind of nosed open the door, peeked inside, stepped inside, had a mask on. She was looking at something she wanted to buy when she heard a very loud voice say, "Hey, you can't be in here. You need to leave." Well, she turned to see the store clerk behind her pointing at the door. She was embarrassed. She went outside. She waited. She saw some people leave and tried to catch the clerk's eye and couldn't. So she just went back in and asked if it was okay to be inside and was just told, well, you saw people leave, didn't you? So there was no eye contact. It was off-putting body language and rude. Do you think the store's owner expected the employee to behave that way? Do you think proper tone and expectations were set for that employee? Or was she simply instructed to admit no more than 15 at a time? Because she did that. She checked the box. She lacked empathy, but she did set the tone for that store. I would have just left, and many of us probably would have, and many of us probably would have blasted the store on social media. My friend was too polite for that, but she did tell me. She probably told others. Typically, one person tells at least one other person, so word of mouth is still a very powerful thing, especially in Maine. So remember the golden rule we all learned in kindergarten: treat others as we wish to be treated. Adopt that attitude that we're in this together. Face coverings don't have to be and should not be a political or social statement. They are about being careful, thoughtful, neighborly. Keep a few on hand in case someone needs one, and make hand sanitizer available. Establish your physical distancing requirements and tell people about it. Are you continuing curbside service? Say so. People are loving curbside. And key messages and scripting will lessen opportunity for confrontation. And notice there I said lessen, not eliminate. Be sure your employees know what to say to someone who is rude or confrontational. It can be off-putting, startling, and there's more on how to do that coming up in this hour. But what is your staff authorized to do as well for potential service recovery? If there is a very unhappy customer, if there's an incident, how do they make it right without having to call you and say, what can I do? How far can they go? Because you want to keep your customers happy, so empower your staff. And finally, yeah, COVID-19 still has many of us worried, including the people you need to come back and engage with you. So talk to your audiences in clear, simple ways with a pleasant tone. Keep it light. Be prepared to pivot. This is very important because we don't know what's going to happen next week, next month, or 2 months from now. So things could change again. So be prepared to pivot. What are you going to do if things change again and your guidelines change? Think about that. Write it down in your communication plan. And if you need some help, we've got you. If you need posters, handouts, scripting, Northern Light Health has items that are free to download on our website. Use them. We want to help you. The Bangor Region Chamber of Commerce has a free recovery toolkit on its website, and the CDC has all kinds of free stuff and information on the web. So don't waste this crisis. Embrace the hard lessons that we have learned. And if you don't have a communication plan, make one now. Think through the hard decisions, the tough questions, the crazy scenarios. Plan how you will handle them. What would you have done differently if you had known a pandemic was coming back in February? Doing this work now will help you later. And I thank you for your time, and I wish you all well in getting back to business.
Well, thanks, Suzanne. That was great. Next up is Yamaya. Many employees are stressed right now, both personally and professionally, Yamaya. Can you help us with some practical tips on ways to support our teams when customers are difficult?
Definitely. Thank you, Dr. Gilkey. In every field, and particularly in today's high-stress environment, when we're navigating how to enforce safety protocols, employees may have to deal with angry, hostile, or non-compliant behavior. It's important to clearly train your staff about what safety protocols they're expected to enforce and how they're expected to respond if someone is non-compliant. When possible, anticipate points of conflict and address any gray areas in advance. For example, if a customer states they can't wear a face covering due to medical necessity, train your staff on how you want them to respond. So what is de-escalation anyway? It's the ability to calmly respond and reduce the intensity of a conflict. If there's just one thing you take away from this part of the presentation, it's this: you cannot control another person's behavior. You can only control how you respond. So first, you've got to keep your tone and body language neutral. The more a person loses control, the less they hear your words and the more they react to your nonverbal communication. Be mindful of your facial expressions, movements, and tone of voice, keeping them as calm and neutral as possible. And avoid overreacting. You really want to practice rational detachment. In other words, don't take behaviors personally. Remain calm, rational, and professional. If it seems safe to do so, it may be helpful to suggest that a customer step into a more private area to talk. Onlookers often fuel the fire of a situation and can even become cheerleaders, encouraging another person's behavior. Be empathetic and non-judgmental. Focus on understanding the person's feelings, whether you feel they're justified or not, as they are real to the other person. And you want to set boundaries. Be clear, direct, and respectful. Because an escalating individual is usually too preoccupied to hear many words, complex messages will only increase their anxiety and make their behavior more difficult to de-escalate. So avoid jargon and complicated choices. For example, you'll say, your choice is to either come back when you have a face covering or call us and we can process your order over the phone. Another helpful tip is to use the yes and stance. When we validate someone's feelings and then follow that validation with a but, the person on the receiving end of the communication tends to hear that their feelings don't matter. Exchanging the word but with and is a powerful communication technique. You'll see some examples on the slide here of different ways you can utilize that technique. You also want to ignore challenging questions. You don't want to get into a power struggle with someone. It's best to ignore questions or statements that are intended to provoke. Redirect attention to the issue at hand. In other words, you're ignoring the challenge, but not the person. Bring their focus back to how you can work together to solve a problem. And, people may need time for decisions. When a person's upset, they are not able to think clearly. Give them a few moments to think through what they've said. And lastly, and this may be also just one of the most important things, is practice, practice, practice. Your confident, skilled response plays a critical role in whether a situation gets better or worse. Share these tips with your team and practice these skills in role plays so everyone can increase their likelihood of de-escalating behaviors before they become dangerous. On that last point, you want to make sure and let people know what to do if someone is threatening, that they will need to contact the police or call 911. So make sure you empower your staff with all these tips. And there are additional resources available through the Crisis Prevention Institute, which website is listed there. Thank you.
Thanks, Yamaya. Dr. Jim Jarvis is here with us again today to provide a quick update on the dynamic guidelines for testing. Jim.
Thank you, Ed. I appreciate that. I was going to reiterate some of the comments that my colleagues have already stated. We've gone over face masks and face coverings quite extensively, and we find that we have the same challenges that I see being posed in the chat room of individuals who, for whatever reason, feel uncomfortable wearing them. We feel this is a public safety issue, and certainly within our facilities, a healthcare safety issue, and therefore we are continuing to enforce our policy that face coverings must be worn to enter into our facilities. Thankfully, we do have guidance on how to de-escalate those situations when individuals find this to be a barrier to their receiving their health care or frankly become confrontational. And so we welcome any questions on that particular area. Testing continues to be something that's ever evolving for us. The state of Maine will expect to start being able to increase the amount of tests that they can run across the state starting the first week in July. That's their anticipated time to getting their new machine. However, we are challenged by the ability to collect the specimens to send to the lab, both in terms of having places where people can get their tests collected, and two, having those very precious testing swabs and media that are necessary to collect that swab and then send it onto the state. All four major health systems in the state are experiencing the same challenges. Those test kits are not readily available to us, as well as their ever-changing guidelines for how to use those particular swabs or media that the swab needs to be transported in. And so we continue to remain up to date as we can on that. But you may find those to be challenging for your businesses, particularly if you've decided that you want to have your employees tested prior to them to opening up a business or as part of surveillance testing to remain in business. Some of you may be considering having some of your clients or customers tested, particularly if you're talking about being a school or a camp or something along those lines. Unfortunately, again, you're going to be hampered by the same situations that we are in healthcare of not being able to readily support all of that. We continue to prioritize all testing where it's clinically indicated, meaning those individuals who are symptomatic, especially those who need to be hospitalized, or those living in a congregate living situation like a nursing home, a group home, a prison, or the like. And that's where our focus is as a healthcare agency. I will state that there are some companies around the country that are able to meet the demand for testing swabs and kits and running those tests. And so if that's a thing that you're interested in for your particular business or your particular situation, you may need to do some research to find a company that is willing and able to do that for you. As Northern Light continues to expand its testing capabilities, we will continue to inform the public on a ready available media or social media platform so that you're aware of what it is that we can do, and we will continue to post those as we see fit. And with that, I will turn it back over to Ed.
Thanks, Jim. So now let's focus on your questions. We will group similar questions together so we can address as many questions as possible. Before I get to the first question, though, I want to draw your attention to the chat space. And you can see 2 questions were asked of the group by Northern Light Health member Andy. And he's asked of the group about what communications methodologies people are using and what seems to work. And the second question was, when you get challenging questions from customers, how do you handle that? And the responses are really terrific. You might want to look there and pick up some additional information. So lots of great input. So now I'll go to the first question here. This first question is for Jim. A Maine resident asks, if I'm going to New Hampshire for 4th of July, do I need to be tested for the virus?
So that's an excellent question. And right now, the governor's order is that if you travel to New Hampshire or Vermont, you may re-enter the state without quarantine or without testing. Both of those states are following similar guidance as the state of Maine, and their prevalence of disease is lower than we've seen in other localities. However, if you travel to any other state, then yes, you are required to follow the governor's order, which would require a 14-day self-quarantine period or being tested for a negative test prior to coming out of that isolation period.
Great, thanks, Jim. I have another testing question, so I'll kind of toss that to you right now, too. Testing increases ultimately contributes to positive case increase. So, we're seeing that the more testing done, the more, positive case identification we get. But are we seeing an increase in hospitalizations?
So that's another excellent question. For the state of Maine has done an excellent job of limiting the spread of disease within our state. So we are cautiously optimistic in that, particularly as we now head into our summer months, where we do know we have lots of visitors from around the country who come and visit our localities. And maybe bringing the virus asymptomatically into our communities. So we're cautiously optimistic there. I will caution when we say that increasing testing will increase positives. It will increase the overall number of positives, but it may actually decrease our positivity rate or the rate of number of positives in relationship to all of the tests collected. Why? Because now we have the ability to test more individuals who may have symptoms, but their symptoms are actually more suggestive of them having a cold or even seasonal flu, which is still out there in low numbers. And what we'll find then is that we may find that many people are actually not carrying the virus for COVID that causes COVID-19, and so that may be a positive outcome. It is alarming that we're seeing some high increases in the number of tests around the country, particularly in states of Florida, Arizona, and Texas right now. Some of that is posed due to the fact that they are doing some increased testing, but because they're seeing increased hospitalizations, it is a better hypothesis that this really has to do with the reflection of how they handled their businesses and their public community initially to the response to the pandemic, and how they reopened much more quickly than other states have, such as Maine. So Maine has handled this well, and we at Northern Light support the governor's guidance and her proposals for a safe reopening of our economy.
Great, thanks, Jim. The next question up is for Suzanne Spruce. A restaurant owner asked, they've been putting a lot of effort into making sure that their employees wear masks at all times and require their customers to come in with masks as well, but do not require it when they're seated in position. Other businesses also seem to be following these good principles, but they're finding that other businesses in their community are actually maybe even discouraging masks. So that becomes very concerning. So from a communication perspective, what can we do to encourage business peers to institute responsible practices?
Yeah, that's a tough one. I mean, speaking as a consumer, and I have been out to eat in some of my favorite restaurants, and I will only go in if there are masks in use and it appears very clean. But depending on the community that you are in, I don't know if you have, you know, like downtown Bangor has the Downtown Bangor Business Group, and then there's like restaurant associations and that sort of thing. So I don't know if you're able to take the more you know, political approach of of doing it together as an industry. You could also work through your chambers of commerce to see if they're able to help facilitate some conversations with businesses on safety practices. But I think you'll find overall, I mean, it unfortunately has become a bit of a political issue for some folks, wearing masks or not wearing masks. And I think over time, you'll probably see consumers, repeat consumers anyway, selecting businesses that are choosing the safe practices such as masking. Obviously, the masks have to come off to eat, but if the staff continues to wear them, I think people will select those businesses.
Great, thanks. The next question up is for Suzanne Mooreshead. And the question is taking temperatures effective in an office setting? And then I'll expand upon that and maybe talk a little bit more about temperatures in conjunction with screening questions to answer this question a bit more comprehensively.
Absolutely. And it's a great question. And in terms of taking temperatures, it's just one part of an overall screening process. If you're taking it as just an individual number, it's probably not the most reliable indicator, particularly in the summer months. People may be coming in, and if you're doing a infrared type of temperature, they're not always so accurate. But taking a temperature in conjunction with asking questions such as, have you been ill? Do you have any respiratory symptoms? How are you feeling? Have you been around somebody? As part of that comprehensive picture, you're going to better identify those individuals that are potentially putting your business at risk and coming in ill. So as an individual component, it's just one piece. It's better with a much broader set of questions.
Yeah, great. Could you follow that up with mentioning what set point of temperature we use at Northern Light Health?
Absolutely. The temperatures that we use is 100 degrees Fahrenheit as kind of the standard, and that is what the CDC has determined as being kind of that most accurate point. It's high enough to work with the environmental temperature. So if you're at 100 or above, it probably is truly a fever as opposed to just being overheated.
Great, thank you. So the next question I have is for Yamaya. Yamaya, a visitor is very agitated and doesn't want to wear a mask. Walk us through how we might de-escalate this situation. You know, we kind of look through the 10 tips, but give us an example of applying those tips, if you will, to this situation.
Great. The first thing, of course, is to get yourself really calm. And the most effective, quick way to do that is to take a long, slow exhale. And just kind of ground yourself before you approach that person. And as you approach, being really mindful of body language, just trying to keep as neutral as possible. You might say to someone just, hi, and, you know, it looks like you're really upset. You know, can you tell me what's going on? Just allow someone to maybe state what their problem is, and listen empathetically and validate their concerns, saying something like, oh, I know, this is really hard. It's hard for a lot of our customers. That really just helps bring someone down and feel heard. And then once they've felt heard and then are able to hear you better, you can reiterate the policy, which is, in this case, you need to put on a face covering in order to come in. Do you need a few moments to get one? Is there anything I can do to help you? Just really being as kind, as calm, as empathetic, and compassionate as possible will really help de-escalate the situation.
Great, thank you. I'll try to make a qualifier. Someone points out that the CDC temp is set at 100.4. So that's been an ongoing discussion. There's a couple of resources that tell us 100.4, others that talk about 100. So I think it's perfectly fine to choose 100.4. It's also perfectly fine to choose 100. So, neither has a strong scientific support, but it certainly is a scientific best guess for either of those. Hopefully that clarifies that point of view. The next question is for Suzanne Spruce. There seems to be all kinds of communication going on, and we started off your session with you can't over communicate, but there's no question that there could be communication overload. So how can we get people to pay attention to the key information we need them to know about? And I think that could apply to both customers and employees. So you have a lot of territory to cover on that question, Suzanne.
Sure. Well, I mean, in 2020, there's information overload everywhere, right? From what the media is giving you, to what you're hearing on the street, to what you email overload, social media, and where do you look, who do you listen to, who do you believe, and who has time for all of that, right? I never get to all of my email. Email is still effective, but it can be one of the worst ways to make sure somebody gets your message, because most of us, especially if we're in a business and you have a personal and a business email, never get to all of your emails. But I think as far as the overload goes, think simple, right? So, and you have to stand out in the crowd. So I mentioned that, if you're using social media, a nice quick homemade Facebook video, something you can share on Instagram, especially if it's clever, a little off the beaten path, funny, or just somehow stands out to get people to share it, your message will start to resonate. But there's also things you can do that are not electronic. A sandwich board on the sidewalk still works really well. People are still driving by, they're still walking by, and your messages on a sandwich board will also be noticed. And I know a lot of the cities in Maine are being very helpful to businesses in terms of the parklets in the street for some restaurants, and so they may allow you to put maybe something bigger than a sandwich board in front of your shop during business hours. For staff, I don't think you can over communicate. This isn't a case of tell them once and they will know it and you don't have to tell them again. I think you have to tell them what you want them to know, and then tell them what you want them to hear, and then tell them what you told them, because it's stressful being in business right now, and not everybody who's coming in is in a good mood. Not everybody wants to wear a mask, and so prepare them with the key messages on how they handle somebody who is confrontational about masking or physical distancing or just life in general, and then support them as they do that. At the end of the day, or couple of times a week, say, how's it going? What are you hearing? How is it working? What's making you feel uncomfortable? And so I just don't think you can over communicate. Just don't put, all your eggs in one social media basket, if you will.
Great, thank you. I know that's a big topic for everyone. Jeff Doran from Northern Light Health makes a point in our chat room, and in the event that we have some folks that are not on the Zoom but on a phone, I'll point this out in a little bit more detail. So what Jeff was reminding us is that people who have out-of-state residences who come into Maine and get tested and test positive in Maine their results are actually reported to their state of residence CDC and applied to their local zip code in their state of residence. So when we look at the main confirmed cases that our main CDC shares with us, that only includes residents of Maine. It also includes people who tested out of state who are Maine residents and are perhaps spending their summer still in Florida. They'll be reported as Maine numbers, if you will. So we get a consistent pattern of reporting across all 50 states. So all CDCs have agreed that that's the way the reporting goes. But it gives us a somewhat false sense of what the prevalence rate is. So for instance, we can imagine in a recreational area, a lake for instance, we may have 0 cases that are reported for Maine residents, but we may have people who are guests from out of state that do test positive in that area, and they are not showing up in our Maine reported statistics. So in that way, our sense of prevalence is not quite accurate. It just reinforces the need to follow the principles of wearing the mask, the facial coverings, exercising, social distancing. So I think that's an important takeaway to understand. Our next question is for Suzanne Mooreshead. Is a face shield only effective? You know, some residents are doing this. I personally have witnessed that recently. So could you comment on face shield only?
Certainly. I've been seeing it as well as I've gone out into the community. It provides a little bit of protection, but it really depends on how that face shield covers. There's still the ability of droplets to kind of fall from below that face shield. So if you're standing over somebody, such as in a restaurant situation, if you're taking somebody's order, it's not necessarily providing the best protection between you and those other people. There are some situations where that may be the only good alternative because of a medical reason, and the medical reasons that an actual face covering can't be worn are fairly small in terms of the actual types of reasons you can't be worn, but there may be some situations where that's at least better than nothing at all, but it's certainly not the most ideal.
Great. And I'll elaborate on that to point out that the virus seems to be best transmitted through mucous membranes of the mouth and nose, but also through the eyes. So you're hearing progressively more about effective eye protection. And certainly the full face shield does a good job with eye, but not such a good job because of the ventilation ports on the side of it all for the respiratory system. So that's something that understanding I think is important when you make decisions in your business environment. The next question up is for Jim Jarvis. Jim, when will testing of everyone be available? I think that's a question on everybody's mind, and all this kind of misinformation that's floating around is very confusing. Help us out with that.
Yeah, so it really comes down to economies of scale. So the state predicts that by the middle of July, they will be able to run 20,000 tests a week. That means that if we were to test every Mainer, it would take 65 weeks for us to test every Mainer once. That would not include any of our visitors, and it would not include those times when we need to test people more than one time. So you can see testing everyone is really just not a viable option for us. And what is a viable option is for us to continue to risk stratify, testing those individuals who are symptomatic and those who are at higher risk for serious illness if they contracted the disease, or for those people who are critical to our infrastructure, our first responders and healthcare workers, so to speak. And so unfortunately, I do not see that we will get to a point where we'll be testing everybody, but we will try to test as many people that will make a major difference in our public health outcomes.
Awesome, thank you. The next question up is for Yamaya. Once the agitation has been de-escalated, is there things I can do to reassure other customers that witness this interaction?
Good question. I think you can just thank those customers for being patient. Most likely the situation has detracted from your being able to provide them with really good prompt care. So just, thanking them for being patient and just continue to move on and not draw more attention to the spectacle. As I mentioned before, when encouraging to potentially move to a private area if possible, you don't want to encourage cheerleading or encourage what could become, again, a political conversation or some sort of debate around protocols, right? So just thanking folks for their patience and moving on to providing whatever customer care you typically do would be my recommendation.
Great, thank you. Our next question up is for Suzanne Mooreshead. You talked a bit about gloves for food preparation, but I think we've witnessed food preparation, managing the cashier function, and back again. Could you speak to that and elaborate a bit more on what it would be to effectively manage gloves in that circumstance?
Certainly. In terms of gloves, you should only be using them for a specific task. So if you're prepping food, continue to wear gloves until you are done with that process, but you haven't touched anything in the interim. So say you're prepping some food, somebody comes up to a register, you need to take your gloves off that you were using for prepping that food. Go ahead and sanitize your hands, take care of your customer, sanitize your hands again before you go back to the initial task that you were doing. In terms of going from customer to customer, there's no way to effectively clean the gloves once they're on your hand without potentially causing tears and these very tiny holes within the gloves. So the gloves really need to be changed between each and every person. So that way, if you pick up something that was, say, contaminated by the first customer, you won't spread that contamination onto an item that the second customer is going to pick up. So it really is just being very cognizant of what you're touching, who does that belong to, and trying to keep like things together, but changing between every customer.
Yeah, that reinforces the idea that the virus itself will take advantage of every opportunity that's presented to it. So if it can infect, it will. So it takes a great deal of thought to go through all the steps that we're talking about today to make sure that it effectively manages it. We have a couple more questions, so I'll ask my speakers to just short and sweet if we can. The first one is, Dr. Jarvis, if you get the virus once, can you get it again?
Unfortunately, we don't know the answer to that. There is evidence that, yes, you can. The sailors that were infected on the USS Theodore Roosevelt, many of them had gone through their entire period of illness, had recovered and returned to duty, and then came down with the same exact symptoms they had had prior to their initial one. And so there is evidence out there that you can get the virus again. It is just not proven. We can't tell that. And then there's some studies that have come out now when we're being able to test for those antibodies, or the thing that our body makes to fight against infections, that the antibody levels wane fairly quickly with this after this virus, which is a little bit concerning as well, that maybe there's that potential that you could get it again, and that will really hamper our ability to have an effective vaccine. So unfortunately, more non-good news about this particular virus. It is challenging in many ways.
Great, thank you. Suzanne Mooreshead, this one's for you. I'll read it right out of the chat room. Recently, an essential worker was told that they would not be tested upon return from an out-of-state, non-work trip because they were not symptomatic. I thought essential workers were supposed to be prioritized for testing, so they did not have to be quarantined. Has something changed?
No, it really hasn't changed. In terms of testing, and if you're an essential worker, you're able to go back to, according to the state regulation, you can go back to work However, you're still quarantined for that period of time outside of work. And it depends on the lab that's running the test as to whether or not they have the capability to run asymptomatic folks to get them through the testing. And also just keep in mind that if you're asymptomatic and you don't have those symptoms, the testing isn't quite as reliable as those with an abundance of symptoms.
Great, thank you. The next question is for Suzanne Spruce. Tell us more about setting the tone for my business. You know, some things are obvious, but what are some of the not so obvious things, the subtle things that really sets the tone in a business?
Oh gosh, I always think that a business reflects the owner, and so I think whoever is running a business needs to consider what's important to them and what are their values and how do they want people to perceive them when they're in their store or doing business with them. So I think setting the tone is really what are your values and what do you want to be known for. Obviously, I prefer an empathetic tone, a friendly tone, open to everyone, and helping people, especially employees who are dealing with difficult customers, because this is a difficult time, and tempers are easy to flare right now, even in some of the most gentlest of people. So that would be my advice, is to stay true to your values and true to the ethos that you've set for your company.
Awesome. Thanks, Suzanne. So I have time for one more question here for Suzanne Mooreshead. We know that 6 feet is the definition for social distancing, and we kind of know it's a guideline. Could you talk about the relative risk regarding safe distances, comparing speaking to yelling, which we're seeing more and more, and singing, for instance? Could you comment on that, please?
Sure. Some of the studies that are coming out show just what the distance is in terms of various types of activities. In general conversation, it's generally considered that the droplets that you breathe out will go about a distance of 3 meters. So that's, or about 1 meter, which is 3 feet, more or less. The more vocal you become in terms of yelling, the further that distance is, and singing, because you are using so much of your diaphragm and pushing your breath out so far that it can spread without a mask quite a distance. So as you're in these activities that have this higher distance and force of breath, that distance should gradually increase to represent that. So while 6 feet's a general guideline for everyday conversation, those activities with that higher breath rate, you really should consider going a little bit further out to help with that.
Great, thanks. I'm going to squeeze in one more question. This is for Jim. The governor has said that all guests coming from out of state other than New Hampshire and Vermont must be tested, and it can be done in Maine. Can this happen for the asymptomatic?
Yes, I want to be clear. The governor said it's an option to be tested, to not have to do the 14-day quarantine. Her guidance also states that you should be tested prior to crossing the border into Maine. And so that's where we would prefer people to have their tests performed. Unfortunately, we don't have many commercial facilities in the state of Maine who are able to handle doing this particular testing. We do know that in the southern part of the state, there are some private businesses, particularly CVS, that is able to handle some of that testing. And right now, there are negotiations going on with the state for health systems and others within the state to assist in being able to expand out our testing. But as I said earlier, our biggest challenge really is the fact that we just don't have those test kits, those swabs, and the transport media in order to accommodate all of these requests.
Yeah, and I think that's an important part to emphasize. You know, I think in the best of all possible worlds, we would all like to do universal testing and be able to sort through all that wealth of data from that, but we are limited by the supplies that are available to us. So Thanks very much. I'm going to close by reminding you that we will be emailing you a survey right after our conference. Please be sure to give us your feedback. We hope you have found the last hour a good use of your time and you were able to identify some useful tips to apply to your business. We are offering this session every Thursday from 11 a.m. to noon for the foreseeable future. If you have ideas for content, please let us know. Remember, you need to register each week. We will send you the link along with the topics for week 4. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will help Maine safely open up for business. Thank you and have a good afternoon.